Did you know that that baby bottle could be silently damaging your baby's teeth all night long? There's a term in dentistry called baby bottle tooth decay. Now, it doesn't exclusively come from baby bottles, but I want to break it down a little bit. Baby bottle tooth decay is a common condition that affects toddlers or infants. It can lead to pain, it can lead to infections, and it can lead to damage to a lot of their baby teeth. It can even lead to damage to the adult teeth later on. The good news is that it is entirely preventable if you break the bad habits. So essentially, this is tooth decay, or cavities that happen because of liquids or sugar that are touching the teeth. Now, the reason it gets that term baby bottle tooth decay is because it usually happens when babies are put to sleep with a baby bottle. Now, if there's any sugary drink in there, like any milk or any formula or juice or something like that, all that sugar from that drink is gonna be entering that mouth all night long. Now, this can be a huge problem because you have this bacteria that live in your mouth called Streptococcus mutans or strep mutans. Now, this bacteria will eat carbohydrates in the diet and it will release lactic acid, which is this byproduct which will damage the teeth and cause cavities. Now, usually this will start by affecting the upper front teeth because that's where that liquid comes in from that baby bottle, but it really could affect all the teeth. Now, this is worst when it happens at nighttime and it's happening all night long because for a couple of reasons. One, we produce less saliva when we're going to sleep. Our saliva is our body's best natural defense against cavities and gum disease. It has a lot of antibacterial components to it. It can help buffer out the acids in our mouth, like that lactic acid, and prevent them from causing cavities. And you naturally have less of it when you're sleeping, so your mouth is at a higher risk when you're sleeping. But now if you combine that with sipping on something that is sugary all night long, now you're gonna be giving your saliva no chance to fight against these acids. And also you're gonna be giving these bacteria a field day all night long. This is actually why it's more important to brush at nighttime than it is in the morning. You might think that they're equal, but if you were to pick one time, I'd recommend you pick it at nighttime because you get less saliva when you're sleeping. Now, normally when we have something sugary or something acidic, we'll give our body time, we'll give our saliva time to build up, to wash away these acids and these bacteria. But when you're sipping on it all night long, when you have less saliva in the first place, and then you're constantly introducing it all night long, then you can really quickly damage these teeth. And also, baby teeth are a lot thinner compared to adult teeth. So while an adult tooth might take a little while to start getting damaged, a baby tooth, it can happen really, really quickly. I've seen a ton of cavities develop in like even 6 months on baby teeth. Now, just like this can happen at nighttime, it can also happen during the daytime. Again, if you were constantly snacking on something or sipping on something throughout the day. And this is true for adults too. If you're sipping on a Coke throughout the day, or you're sipping on Gatorade or something, or if you're constantly snacking on crackers, or anything that is really starchy or has a lot of carbohydrates, or anything that's acidic, or anything that has sugar in it. And the thing is that most drinks are acidic. Anything that's basically not water is acidic. So things like your coffee or your tea or your juice or even your diet sodas or anything like that, they're all very acidic and they can still damage your teeth. So all of this constant exposure, kind of similar to nighttime, you're not giving your saliva time to build up and wash away these acids and these bacteria and these plaque and food particles. And especially with baby teeth, because baby teeth are so thin, they're so much easier to get a ton of cavities. So dentists actually recommend bringing the baby in for their first visit as early as 1 year old. And you should be brushing a baby's teeth as soon as that first tooth erupts in the mouth. Even if it's just wiping it with like a wet cloth or something like that, or brushing it without any toothpaste, just some water, just so you're cleaning away any of the bacteria that are building up on that tooth, and you're also preventing that bacteria from releasing these acids that cause cavities. You can even take like a wet cloth or something and wipe the gums a little bit to help keep them clean. Now, you might think that baby teeth aren't important and they're gonna fall out anyway, so why should I care so much about these baby teeth? Well, baby teeth can be really important. For one, they're placeholders for the adult teeth. So the baby teeth are meant to fall out as that adult tooth is coming in. And if the baby tooth falls out too early, then the adult teeth are gonna be way more likely to be crowded. And the reason is, when these baby teeth fall out early, then the surrounding teeth will kind of close in that missing space. This can affect the jaw development and make the jaws not grow as wide and forward, and also make the teeth come in way more crooked or not even erupt at all. This can lead to way more expensive bills later on in life, like going to the orthodontist or something like that, or even a jaw surgeon or something to correct these problems. problems. But also, if these baby teeth end up getting an infection or something like that, this infection can spread to the adult teeth, because that infection can keep spreading if it's not addressed. And now you potentially have a problem with your adult teeth before those teeth even came in. I actually made a video going into more detail on why baby teeth are so important and what all the roles that they play are. So I'm putting a link in the description below where you can check that out. So what are the best ways to prevent something like this baby bottle tooth decay, or really any cavities on baby teeth? The biggest thing is, one, avoid putting them to bed with a baby bottle, especially with a sugary drink. And also making sure you brush their teeth both in the morning and night, but especially at nighttime. That way, after you brush their teeth, they're not exposed to any acids all night long. If they really have to have something to drink while they're sleeping, just give them water, no sugar or anything else in it. Also, you want to clean their gums and their teeth daily. We talked about how when that first tooth erupts, you need to start brushing it or cleaning it, even with a cloth or something like that, and even wiping the gums with just a wet cloth or something. You don't really have to use toothpaste at this point. Just brushing the area will do more than enough. Now, if a cavity is present, one, you're gonna know this by going to the dentist as early as 1 year old. Or if you see something like white spots on the teeth or any black spots on the teeth, these are all signs of early cavities. If you see these, you want to get them addressed right away by going to your dentist, and probably you're going to end up going to a pediatric specialist to get these cavities addressed. So I hope you guys liked that video, and I hope you guys learned a little something about the importance of baby teeth and the importance of taking care of them early on to prevent major issues. As always, if you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Have you ever seen someone that never brushes and never flosses and they never go to the dentist and they still never get cavities? But you, on the other hand, you brush, you floss, you take good care of your teeth, you go to the dentist, but you still have problems, whether it's cavities or gum disease or something. What's their secret? Do they know something that you don't? Should you stop going to the dentist?